Right, let's look at today's question. Can you explain what ASPD, Antisocial Personality Disorder, is? I can. Now, Antisocial Personality Disorder is commonly abbreviated to ASPD or APD, and it is a particularly challenging type of personality disorder, and it's characterized by a lack of respect for other human beings, and also a complete disregard for socially accepted norms and rules. The behavior associated with ASPD is impulsive, irresponsible, and can sometimes even be criminal. Someone with antisocial personality disorder will typically be manipulative and deceitful and reckless, and will exhibit a complete disregard for other people's feelings. They just won't come into the equation. Now, although psychologists would never use this term in a diagnosis, individuals with ASPD are often described as sociopaths. Now, whilst there's no single cause for the disorder, there are a number of factors which can contribute to the development of ASPD. One of them being the trauma experienced during key developmental stages as a child. Now, most psychologists do agree that the environment of a child's upbringing does carry the most weight when it comes to the causes of ASPD. For example, children who don't receive nurturing tend to grow up learning that they have to take care of themselves because no one else will. Some children who experience abuse, manipulation, violence from an early age then come to model this behavior as they themselves grow older. Now, I suppose there are a number of other factors which can also significantly contribute to it. Maybe unusually high or unusually low levels of serotonin. Now, serotonin is the chemical in the brain that regulates our moods and emotions. And it can also be a combination of genetic factors that, could result in a very strong predisposition towards ASPD. And then, of course, you've got problems with drug or alcohol abuse, which may increase a person's odds of developing antisocial personality disorder. Now, some of the main symptoms of ASPD I'm going to put on the screen so you can pause the video and have a look. People with antisocial personality disorder tend to come across as very arrogant and with an extreme sense of superiority. And where they're able to, they do use humor and charisma to manipulate others and get their own way. They have extreme difficulty maintaining long-term relationships, friendships, and even other fulfilling connections, generally because their behavior often results in emotional harm to the other person. The treatment of people with ASPD is extremely complicated, and it's complicated by the fact that people living with personality disorders generally don't recognize that there are any issues with their behavior, so they don't even consider the possibility of getting professional help. And because of this reason, there really is insufficient data on the treatment of ASPD. Therapy and other treatments can, after all, only work if the patient is willing to put in the effort, right? If the patient is resistant to the treatment and doesn't want to put in the effort, doesn't want to work, but doesn't think there's anything wrong, you can lead a horse to water, but you can't make them drink. So there you go. ASPD, Antisocial Personality Disorder. Complicated one. A complicated one, to say the least. All right, come on. I haven't got all day. Show me today's question. Oh, shit. That's a complicated one. Okay, I'm going to need to I'm going to need a few minutes to put the symptoms onto the screen. Come back in 10 minutes. I need to write the symptoms. There are a lot of symptoms.